Welcome to this NANB webinar. My name is Joanne Leblanc-Chiasson. I am a practice consultant at NANB. Telenursing is rapidly expanding and being used more commonly. This expanding model of care carries risks and requires additional considerations to ensure it is appropriate. This webinar will reflect on the essentials of telenursing practice. I would like to acknowledge that the content of this webinar is based on the content of the Virtual Nursing Practice Guideline and Webinar of the College of Registered Nurses of Newfoundland and Labrador, and on the Practice Guideline on Telepractice from the College of Nurses of Ontario. The term nurse will be used throughout the presentation and relates to the registered nurse, the graduate nurse, and the nurse practitioner. Telenursing is defined as the use of information and communication technology to deliver all types of nursing care at a distance. The technology used can range from simple to complex, which can include the telephone, text, emails, two-way audio-video conferencing, and even telerobotic technology. It allows for virtual interaction in real time to provide nursing care such as assessing healthcare needs, initiating and evaluating care plans, monitoring health conditions, delivering education, and counseling. Often, virtual care is the desired option and may even be the only option for those who live in rural or remote areas when face-to-face visits are not always available. The COVID-19 pandemic and the subsequent public protection and social distancing protocols have further highlighted the unprecedented need for the use of virtual care technologies to deliver nursing care safely. Within its mandate to protect the public, NANB articulates the professional expectations for telenursing practice. The Guideline for Telenursing Practice identifies the essential components for this type of practice. These are accountability, competency, client-centered care, and support of telenursing practice. Even though telenursing changes how nursing care is conducted, it does not fundamentally change the nature of nursing practice or the nursing process that is foundational to the delivery of nursing care. If you're involved in telenursing or planning to be, please refer to the Guideline for Telenursing Practice. I will now summarize each component and related practice expectations. The first essential component of telenursing practice is accountability. Nurses involved in telenursing practice have the same accountabilities and professional obligations that apply to in-person care. As such, nurses involved in telenursing practice in accordance with legislation and regulatory requirements, which include meeting NANB's registration requirements and the requirements of other jurisdictions. And it's important to note that these registration requirements in terms of telenursing practice may vary from jurisdiction to jurisdiction. Also, nurses are obliged to respect the scope of practice as defined by the Nurses Act, the Standards of Practice, and the Code of Ethics. And nurses are also expected to practice in compliance with applicable provincial and federal legislation, which includes determining who is considered the custodian of records and complying with related legislation as applicable, and respecting the Personal Health Information Privacy and Access Act by upholding confidentiality. Nurses are also expected to maintain evidence-based, high-quality nursing practice and recognize and act if client care and safety is compromised by telenursing care. The second essential component of telenursing practice is competency. Nurses are responsible for assessing their competence, identifying knowledge gaps, and seeking education to address these gaps in the area of telenursing practice. If you identify gaps or a need for education, it is important to notify your employer to address these and ensure competency. Nurses are expected to use credible research findings and evidence-based practices to improve access to quality telenursing care, which includes use of appropriate technological modalities that meet client needs, are practical and easy to use, and align with client location and care setting. Nurses are expected to apply strategies to reduce the risk of missing important information and enhance communication and care in the context of telenursing practice. There is a list of strategies in the practice guideline on telenursing practice. When delivering telenursing care, nurses document according to the standards for documentation and ensure a consistent method of collecting and recording information is supported by employer policy, including when the client's health record is not accessible and when information communication technologies are used to seek or provide advice and/or information to other healthcare providers concerning client care. The practice guideline provides a list of items to include in the documentation of virtual care. The third essential component of telenursing practice is client-centered care. Nurses are expected to use telenursing in the client's best interest. Nurses are also expected to reflect on the appropriateness of telenursing practice for each client, considering the following: the purpose of the encounter, access to comprehensive client care, continuity of care, access to the client's health record, access to the required technology in private space, the client's skills with technology, the client's need for support and preference of modalities, as well as cultural safety. Nurses are also expected to establish and maintain a nurse-client relationship throughout telenursing encounters in accordance with the standards for the nurse-client relationship and use information communication technologies in a manner that supports the nurse-client relationship. Nurses involved in telenursing care recognize that clients retain the right to make decisions about the management of their own health care and respect obligations regarding consent, informing clients of the benefits and limitations of virtual care, the potential requirement for in-person care, and alternate ways of obtaining care. The fourth essential component of telenursing practice is support of telenursing practice. Nurses contribute to the development and quality professional environments that support telenursing practice. Nurses are therefore expected to advocate for the development and implementation of policies and position descriptions that clearly articulate roles and responsibilities in telenursing practice, and for the use of current and innovative information communication technologies that support the delivery of quality telenursing care. A list of items to include in telenursing policies is included in the practice guideline on telenursing. So even though improved client access to care is one of the benefits of telenursing, there are related risks and challenges with this modality of care that relate to existing barriers to accessing, collecting, and interpreting information because of the lack of face-to-face contact with the client, and also because of reliance on technology to relay this information accurately and comprehensively. To mitigate the risk related to telenursing practice, clearly defined accountabilities and policies to support telepractice and ensure a quality practice environment are essential. The Canadian Nurses Protective Society have legal and risk management resources available on virtual care, and these are listed in the practice guideline. Again, for more details and information on the essential components of telenursing practice and related expectations, please refer to the guideline for telenursing practice. To help reduce the risks when engaging in telenursing, nurses must reflect on the appropriateness of this method of delivering nursing care as it relates to the client in terms of the care required and his capacity to participate virtually, as it relates to the provider in terms of the scope and standards of practice, personal competency, and scope of employment, and as it relates to the environment in terms of the technology and support available. The fact that the client is in a different location can create barriers and challenges in the nurse's ability to comply with the standards of practice, to apply the nursing process, to provide appropriate care, or the environment may not lend itself to this practice. Therefore, telenursing practice may not be appropriate in all situations. Virtual nursing care should mimic the kind of nursing care that you would be providing if you were face-to-face with that client. It should not compromise nursing care. There are three very important elements that should be considered to determine if telenursing is appropriate, as shown in the framework. These are duty to care, technology, and support. Now let's look at what needs to be considered for each element. When engaging in telenursing practice, a duty to care is established the moment the nurse interacts with the client through technology to provide nursing care at a distance. Since nurses are held accountable for safe, competent, compassionate, and ethical care at all times, if providing care virtually does not allow for the nurse to fulfill her duty to care or provide care as required, then other means of providing care must be considered. When reflecting on the duty to care, nurses must reflect on their accountability, on their competency, and on the client's needs. This requires you to consider if you can ensure the following: compliance with legal and regulatory requirements. So, can you comply with the applicable federal and provincial privacy laws? Several factors determine which laws apply and who oversees them, such as the nature of the organization handling the personal information. Is it a federal, provincial, territorial, or private institution? Where the organization is based, what type of information is involved, and if the information crosses borders. Therefore, it is important to seek guidance from your employer or the agencies responsible for the application of these laws to determine which laws apply to your telenursing practice. If you're involved in a private practice or employed by an independent contractor, it is also important to be knowledgeable and comply to laws that relate to the custodian of records. A toolkit for custodian of records is available on the Government of New Brunswick website. Please note that questions related to applicable laws can be directed to the Canadian Nurses Protective Society. In terms of registration requirements for telenursing practice, these differ amongst nursing regulators. Nurses residing in New Brunswick are required to hold an active registration with the Nurses Association of New Brunswick to provide telenursing care to New Brunswick residents. This also applies to managers and supervisors of nurses delivering telenursing services. Nurses residing in other Canadian jurisdictions are required to be registered to practice in New Brunswick to provide telenursing care to New Brunswick residents. Nurses engaged in telenursing practice must establish whether registration is required in the jurisdiction where the clients are located, even temporarily, where the nurse is physically located, or both. This requires that the nurse contact the regulatory body where the client is located to determine if registration in that jurisdiction is required prior to providing telenursing care to residents of that province or territory. In addition, the scope of nursing practice can differ from one jurisdiction to another. Therefore, it is prudent to determine the jurisdiction in which the nurse is considered to be practicing in order to ensure that the practice conforms to the permitted standards and scope of practice in the relevant provinces or territories. In some cases, the nurse could be considered to be practicing concurrently in more than one jurisdiction. The nursing process is expected to be applied in the context of virtual care in the same manner than in face-to-face care. It is therefore important that you reflect on how the nursing process is going to be applied. How are you going to assess the client's needs, plan the care, implement the nursing care plan, and evaluate the care provided? And, as importantly, how will this be documented? The technology must not compromise safety, quality, or evidence-based practice. It's also important to ensure that the client can participate in this virtual application of care. Recommending that the patient apply available safeguards themselves, such as a private password-protected email, is also an important aspect in ensuring their safety. Each nurse should ensure they have the required technical and clinical competencies for telenursing practice, or take action to acquire and ensure these competencies as required. Telenursing must always be used in the client's best interest, be based on the client's needs, and the challenges related to using technology must be addressed with evidence-informed practices. It is important to ensure that the client is informed about the limitations of telenursing, such as breakdown of technology, barriers to communication, potential breaches in confidentiality, and also informed of alternative ways of obtaining care in the case that provision of virtual care is temporarily interrupted or no longer possible, or to respect the client's right to choose other options of care. It is important to have a process for ensuring continuity of care, for instance, if a face-to-face clinical assessment is required. In some settings, it has been established that all initial consultations must be held face-to-face, and of course, some conditions cannot be properly assessed virtually. Also, it should be clear how to proceed if you need to refer to other professionals or for diagnostic or pharmaceutical services. Decision-making tools or algorithms supported by policies and procedures can assist in ensuring continuity and consistency in care. When engaging in telenursing practice, the next element that needs to be considered is technology. This requires you to consider the level of technology. So the form or level of technology being considered or used must allow for the delivery of the required care and meet the needs of your patient population. The technology should also be easily accessible and easy to use for your clients. It is important to ensure that the patient understands how to use the technology available. The risk for privacy and confidentiality breaches must be managed with technological and cybersecurity measures or safeguards with the use of the following. For example, a dedicated computer and phone line, and this also applies to the work from home environment. Protective, strong passwords and user IDs. Encryption of data for emails and portable devices. An email confidentiality notice and disclaimer. And up-to-date technical safeguards such as firewalls and virus scanners. You must ensure timely updates and upgrades to the technology that is being used in your practice. It is also important to consider that as care evolves or changes are brought to the care plans, changes may also be required to the technology being used to deliver optimal virtual care. When engaging in telenursing practice, the third element that needs to be considered is having the appropriate support. This requires you to consider availability of policies and procedures. No matter in which capacity you are involved in telenursing, you may be an employer, an employee, an independent contractor, or self-employed, policies and procedures should be in place to support virtual nursing practice and to allow for the safe and effective provision of care. These policies should address the specifics of when, how, and the purposes for which nursing care may be provided virtually, any conditions or restrictions on this mode of care delivery, and what safeguards are to be in place. Policies must also be in place to support adherence to applicable legislation as previously mentioned. Nurses should be involved in advocating for and in the development of related policies. A list of suggested policies and procedures to support this type of practice is available in the Guideline for Telenursing Practice. Safeguards are important to assist in mitigating risks that may arise while using a virtual platform to provide care. There are physical, technical, and administrative safeguards. Some examples of physical safeguards are having a private workspace, restricted office access, secured locations for keeping technology containing personal health information. On top of the technological security measures to protect from privacy breaches that were just mentioned in the previous slide, processes should also be in place to manage technology failures. This will ensure that the steps to address such situations are defined and readily available when these occur to ensure client safety. Some examples of administrative controls include concise security rules related to access controls, cybersecurity, selection of technological solutions, service vendors or platforms, audits for compliance with related policies, proper training for the use of the virtual platform, including security training, and processes for the management of privacy breaches. Refer to your employer or employer policies for guidance. If you are involved in self-employed telenursing practice, it is important to determine which safeguards are required as it pertains to your telenursing practice. Please refer to CNPS or to your legal advisor for guidance. The infrastructure required to support consultation in collaboration with other healthcare professionals must be in place to ensure continuity of care. In conclusion, because of the inherent risks related to providing care through technology, principles are required to guide this form of practice to ensure safe, competent, and ethical nursing care. Practicing telenursing requires some reflection because it may not always be appropriate. Nurses should always be reflecting on their practice and advocating to ensure safe, competent, and ethical care and quality practice environments. When engaging in telenursing or virtual care or developing this platform as a means for providing care, it is encouraged to connect with the Canadian Nurses Protective Society to ensure appropriate liability protection for this type of practice. CNPS periodically broadcasts webinars on telepractice and have variable resources on their website on the topic. A telenursing toolkit is available in the resource and documents section of the NANB website. This toolkit includes resources to assist nurses and employers in providing safe, competent, and ethical telenursing care and to inform the public on virtual care. In the toolkit, you will find the guideline on telenursing practice, an FAQ on the registration requirements, a framework for establishing the appropriateness of telenursing, a link to this webinar, case studies, resources to assist in managing the risks associated with telenursing practice, and resources and a guide on virtual care for the public. Thank you for taking the time for this webinar, and I hope it has provided guidance on the requirements and considerations that need to be taken into account when considering telenursing practice or when involved in the provision of telenursing care. If you have any questions relating to this presentation or on the topic of telenursing or any other nursing practice topic, please reach out to the NANB either by phone at 1-800-442-4417 or by email at nanb@nanb.nb.ca.